Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, a Changing America. I'm your host, Anthony Moreno. Thanks to a new grant awarded to the Burrell College of Osteopathic Medicine, promotores and community health workers will receive free suicide prevention and HIV/AIDS training. Joining us to talk more about the work involved with this grant, as well as the impact it may have on our community, is Norice Lee, Associate Library Director at Burrell College of Osteopathic Medicine, and Gena Trujillo, Director of Southern Area Health Education Center at the Center for Health Innovation in Las Cruces. Thank you both for joining us and sharing more about this grant and how it may help our community here in southern New Mexico. Norice, I'd like to start with you. If you could share a little bit about the grant and the mission of it.
Okay, so, and thank you for the invitation to be here. So this grant is through the National Network of Libraries of Medicine, South Central Region. That region falls under the National Library of Medicine, which falls under the National Institutes of Health. So what they do is they are our regional funding entity, and they distribute funds for community projects, for any type of project that will help optimize the use of information resources that are freely available to the public. So a number of different databases and other types of materials that we then integrate into projects through their funding.
Okay, so I'd like to hear how you can really apply this data and information and educational resources to the community by working with Gena's organization. So how are you two working together, and what sort of plan do you have with this grant? I'd like to hear from you both on this.
Okay, well, I can just start briefly and say that we are librarians, and working with money through the National Library of Medicine and our region, we provide the health information piece. So the health information resources, but that's just part of it. So what we're looking forward to doing with Southern AHEC and working with Gena and her folks is to be able to actually integrate those resources into meaningful training opportunities. So we partnered and looked at some different areas where we knew that we needed to provide greater access to health information, and at the same time provide training. So it was kind of, it dovetails one another.
Very interesting. Yes. So how does your organization, Gena, really kind of play a role in getting this information out to the community?
So our main role is to provide community health education to communities in southern New Mexico. So AHEC is one of 3 AHEC centers in New Mexico, and Southern Area Health Education Center covers 13 counties in southern New Mexico. So we cover from Cibola down to Doniana to our eastern counties, Lea and Eddy, and that is one of our priorities, or one of our main aims, is to educate the community in whatever resources there are available, because we do come across colonias or rural areas that don't have the access to transportation or getting those resources. So what we're doing with this grant is actually bringing it to them.
Okay.
And educating the community health workers, because they work very well in their communities and they know it firsthand.
So the community health educators and workers that you work with in the different communities here in southern New Mexico, obviously there's a lot of rural communities that don't have probably easy access to medical care, or they have to travel very far, or perhaps they don't have access to the internet to where they can use online resources to really figure out where they need to go to get information. So how do you kind of crack that code of the digital divide and people who don't have transportation, going into these communities? What do you do?
And that's one of our priorities, is to get the information to the community health workers in these areas, because they actually live there, and they'll have that connection with community members. So if we provide the education, the best way to get it out, right, is by word of mouth. And so if we can provide the education to promotores, they can go and provide the information to community members. So really what we do is we travel, we go out there, and we provide whatever resources we can for members or community members.
I know in recent years there's been efforts by institutions, universities, higher learning institutions as well to have more promotores out in the community, health educators, programs that could help strengthen those numbers. Is there a challenge already right now with having enough community health educators out there?
So we have
900 in our state.
Okay.
And in the 4 areas that we are going to provide the trainings at, which would be Anthony, Deming, Sunland Park, and Las Cruces, there's 58 to 60 certified health workers. So, and then you come across that barrier, right, is you have the certified health workers, but then you also have community members who are acting as promotores anyway in the community. So we'd like to invite them to our training as well.
Okay.
Just because they don't hold the certification doesn't mean they cannot attend.
Yeah. And certification is voluntary.
Right.
Okay.
Although the goal within the state is to increase the number of certified community health workers.
So let's talk about a big part of this grant is aimed at suicide prevention. And I know that it's obviously an issue here in New Mexico. Norice, I know you have some information on this. I guess I was looking at the Center for Disease Control, and they stated it was the 10th leading cause of death in the United States. This is in, I believe, 2016. But such a big issue here in New Mexico. Can you kind of give our audience how big of an issue it is?
Sure. Within the United States, New Mexico ranks 4th from the top as leading in suicide deaths. So that's already very high. What was alarming to me when I was gathering the information to prepare this proposal was that it's the 2nd leading cause of death in our state for ages 15 to 44, and that's pretty significant, and that was surprising to me. It is the 9th leading cause of death for the next age group, and so that would be 45 to 54.
Yeah, I said Centers for Disease Control stated 45,000 deaths in 2016, but there were 1.3 million who actually attempted suicide in the United States. Now, those are really staggering numbers. Now, with the information, with this grant, I mean, what are some of the ways that you are going to work to prevent suicide? I know that there's been issues, a lot of folks say that when it comes to suicide, economic issues play a major role. What are some things that you're finding with this?
So we are going to, we have a trainer, so she will be training on QPR, which is question, persuade, respond. And these are to ask, it's like 3 main questions that you try to ask a person to see if they're suicidal, because we don't know. I mean, you know, you go out there, people have smiles on their faces. I mean, you think everything's okay, and you don't really know what's going on. And many people suffer from depression, and more than we know. So we want to educate the community members on signs to look for in individuals, so that they know how to respond, so that they know who to refer them to. I'm sorry, it's question, persuade, refer. That's what it is.
Question, persuade. I mean, but it also has to deal, when you're asking people about their mental health and how they're doing, it's not always the easiest thing to talk about.
Exactly.
So how do you really kind of get people comfortable and let them know that it's okay to talk about these things or talk to somebody?
And I think that's what's so important about this grant, to train the community health workers, because people are going to let them in because they know them. If it's us going out there to train them, they're not going to respond to us as great as they would to somebody they know. So if we can kind of educate them, I think, and, you know, kind of provide resources for them and know what to look for, I think that's going to help them, you know,
Right.
promote it in the
So
communities.
they're gonna learn the basics from the QPR training, and then we're going to come in, the librarians, Erin Palazzolo, who's the library director there, and myself. We're going to come in and do the training that's at the end of each session, and provide them with resources so that they can continue to stay current, so that the promotoras, the community health workers, can continue to stay current on the topic. So as research identifies additional ways that it can be helpful, or different techniques or practices, they can stay up to date on how to be effective within their own communities.
So other challenges with getting into communities, you mentioned obviously transportation being an issue of people seeking health.
Right.
Also technology, digital divide. I mean, are there any other challenges? Because I'm kind of curious, is there still a cultural stigma as well attached to being able to talk about a lot of these issues?
Oh, yeah. And we see it a lot, especially in our other communities. Sometimes there's language barriers, you know. So we try to educate as I guess, as, how can I say it, as great as we can, you know, to educate communities and to make them feel comfortable when we do go out there, because transportation is, I think, one of the biggest issues that they have. So for them to get to a doctor, for them to get to the dentist, for them to get anywhere, and if you have somebody that has behavioral health issues or, you know, mental health issues, where are they going to get their medication from? How are they going to get there? How do they even know that's available to them? So by us taking this lead and educating, even if we can educate 10 people in a community, that can go very far, because they can express it to their families. But I mean, you have some communities that don't have running water, they don't have electricity, they don't have Wi-Fi. I mean, there's a lot of that.
Well, yeah, I mean, there's a lot of folks here in New Mexico. I don't think it's any secret that there's a lot of people dealing with poverty that have a lot of basic necessities they're really struggling to meet. So it's a lot, I guess, you know, it may be difficult to focus on taking the time for yourself to figure out how you're doing with your mental health. And also, I'm a little curious as far as healthcare providers here with behavioral health being such an issue in our state. Do you feel that this is going to help current healthcare providers in our community as well identify more people that may be needing help, or helping them perhaps amplify that they're available for help services and things like that?
Well, I don't say that we can say specifically that it will, but our hope is that promotoras are critical members of the healthcare team. In many instances, they work closely with clinics, with public health agencies, and so the links in many cases are already there. And so by helping to support them and having these links, hopefully it will feed back and forth between a physician and the promotora and the community. So, you know, and in many instances, our population doesn't have health insurance. And even people who do have health insurance, it is still difficult to get access to mental health services. So it's just exponential when you talk about people out in the frontera.
Yeah, so let's stay on that topic a little bit, because you mentioned people not having health insurance. So what are some other reasons, some other barriers that you think are in the way from people getting, you know, the help or education they need in regards to suicide prevention and even HIV/AIDS prevention awareness as well, which is part of this grant?
Well, I think you hit on it earlier. You know, culturally, with both of these different topics, there's a huge stigma attached, and I think it varies the level in which someone is willing to talk about their own personal situation or what they might need help with. It varies from culture to culture. And I think we need to be especially sensitive in our area about potential stigmas and why people wouldn't be asking for help.
Yeah, the numbers with suicide in New Mexico that you brought up, I mean, are really staggering. But I do want to talk about another major part of this grant, moving on to HIV/AIDS prevention and awareness and education. I know the Centers for Disease Control said that there has been a rise in HIV/AIDS infections, specifically among Hispanic Latino males who have sex with other males in the past 5 years. We talked about being able to talk about issues and things like that, and cultural issues as well. I mean, how do you expect to get the education out so that people are aware of these statistics and risks that are involved out there?
So we have a HIV/AIDS training module that we use, and 1,200,000 people in the U.S. live with HIV, and 1 in 8 people don't even know that they have it. So when you listen to those stats, it's alarming, and if you don't know that you have it, you could be spreading it. 93% is spread sexually, and 6% is spread through syringes, drug use, and less than 1% was transferred from mother to baby during pregnancies. So yeah, it's very alarming with the statistics, but that is also a topic that people don't like to talk about, and they're not going to share, out with anybody really that they have this.
Is it still as tough to talk about as it used to be? I mean, I know, back in the 80s, it was almost, and even 90s, it was almost a death sentence for a lot of folks. Now we're seeing people who are living with HIV, AIDS, and carrying on, a fairly normal life. Some people, and so I'm kind of curious: does that have any kind of an impact, or is it still very tough to talk about?
I think people don't just come out and say, I mean, it's with any type of disease, that you may have. You don't just come out and say it. You may, share it with close people or your relatives. But I think that is a hard topic to talk about right now still. But it's getting better. I think it's getting better.
How big is it really impacting our community? Because I saw a stat from the Centers for Disease Control that said in 2015, 23% of the people living in the United States with HIV/AIDS are Hispanic, Latino. Obviously, that would cause some concern for a lot of folks, I'd imagine, in our region, just how prevalent it is among that demographic. So, I mean, how do you really take that on to really let people know that there is a risk of HIV/AIDS? I mean, what are some of the things that you're able to do in our community to educate people and make things a little bit more comfortable to talk about?
I think
obviously, and this is definitely just one of many ways that our community is trying to help address the issue, and I think adherence to treatment is a big issue, and I think it was interesting what you had mentioned with CDC. So the number is increasing of males with HIV is increasing, but really in New Mexico it's increasing. In the United States overall, it's stabilized. So that's a concern for us in that our area, the numbers are increasing. And so that's something that we want to address. And we can address these things in our training, and we plan on it, and just providing numbers and information in a kind of train the trainer situation is going to help get that out into the community. But it's just one of many ways that we can help. There are other agencies and other community-based organizations in our area, and I certainly couldn't name all of them or even most of them. But I think it's one of the situations where it really does take a village, and it will take a village.
Well, speaking of that, I mean, we talked about some barriers to really getting the education and information out to people to let them know about an possible increased risk of HIV or AIDS. You've mentioned lack of health insurance and as well as language barriers being an issue. But what about trust in the healthcare system in general? How big of an issue is that in our area?
Well, it's big.
Yeah.
You know, when patients are getting, you know, transferred from doctor to doctor to doctor, getting different information from each one and not really taking the time to look at their whole health history, it's discouraging for them to even go to the doctor. And so I think that's the cultural competency that we see. It's a barrier here, and, you know, educating them. And if we can have, I mean, of course, who wouldn't want to have like a one-stop shop, right, where you can see a provider and see, you know, a psychiatrist, whatever the case may be, in one place instead of having to go from place to place. But that's, I think that's a big issue still. Then they don't trust providers because they're not getting the attention, or, you know, they're not getting it met.
Do we understand, like, have an understanding really how that's changed over the years, to where you used to go see your family doctor and they could take the time to talk with you, and now we're looking at situations where your family doctor was bought out by a healthcare conglomerate, and they have more patients and they're trying to maximize their profit. It's a business as well.
Right,
so they don't spend as much time with people and talking to them, so you don't have that trust. Is that an issue? I mean, do you see that over the years happening?
Well, I mean, yeah,
I think it's probably an issue for everybody. And so just any time you have a special population, then the problem is just exacerbated.
And
So
now they have telehealth too, which is, I think it's going to be helpful for a lot of patients.
Okay.
Because you're able to talk to them, you know, from home. You don't have to get up and go. Now the barrier you might have with that is if you don't have access to Wi-Fi, or you don't have a phone, or you don't, you know. But I think it's going to be a great.
Well, what about older people of an older generation
Yeah,
who aren't
they're not
used
used
to
to that.
talking on a
Right.
video camera to their healthcare provider
Right.
and sharing all that information? I mean, do you see that can be another
Oh, yeah.
issue?
Yeah.
So how do you think this grant can help address some of these issues, lack of health insurance, language barriers, and also distrust in the healthcare system? Is it possible to address these issues with this grant?
I think we can touch on them. I mean, certainly these are major issues within our society. And so, you know, I think the real goal of the grant is to, you know, provide one small way to help improve the overall situation.
Right.
So, you know, certainly we're not going to have that great of an impact, but it's like, you know, it's like the little kernel that you know,
We'll get there.
with yes, you know, we can make a difference.
Right.
And then, you know, ideally we would like to expand this project, and so across the state, and get more promotoras involved, and have regular training that includes authoritative health information, because information is power. And, you know, if we can empower people, individual health consumers, trainers, health educators, that's going to help the situation overall. It's not going to be the answer, but it's one way that we can help improve the situation.
And how do you think, though, that people can also understand a better sense of the culture that they're dealing with? I mean, New Mexico, it's a big state, it's a rural state.
We're a border.
It's located on the border. You have different cultures here. So how do you feel that, you know, that you can really understand the different cultures in a lot of these different areas in our states? It's
Well, I think
so
that's
large.
that's the benefit of having community health workers, because these are people who live in those communities, and they're trusted individuals within those communities. So as Gena mentioned earlier, you know, for me to go into one of those communities and say, you know, I know what's best for you,
They're not going to.
it's not going to be well received, and probably shouldn't be as much as it would be from someone who they
They're
know and
familiar with.
trust and family. So I think that's the real benefit of having promotora training and having promotoras be a part of this project. And then expanding it across the state. So while it may not always be, Hispanic or Latino population, it may be whatever population is in that community. And so having someone who identifies closely with them is going to give it relevancy and value.
How do you see the work that you're doing right now? Do you think it could have an impact on the policy level eventually with what you're able to do?
Yeah, we would hope so. I mean, I think the more individuals that get educated on it, I think that's where it could possibly go there.
Yeah, and I want to mention also, maybe at some point policy, but I think with the focus being on education. And so another partner in this project is Doña Ana Community College. And they have in their public health department, I believe it's called department, they have a certification program for community health workers. And so they're training individuals, and that helps the economy. Education helps in so many ways, helps the state, community, we all know what that does. So they're a partner, and when students graduate from that program, not only do they get a certificate from Doña Ana, but they are then eligible to get certified by the state, the community health worker program within the Border Health office within the New Mexico Department of Public Health.
Well, it'll be interesting to see how all of this plays out, and congratulations on the grant. Unfortunately, we're out of time, but I want to thank you both for joining us.
Thank you.
Thank you very
us.
much for your
Thank
interest.
You.
And we want to thank you for joining us. And on Fronteras, Changing America, I'm your host, Anthony Moreno, and we'll see you next time. Don't forget, you can always stay updated with the latest news at krwg.org.